Congratulations! If you pulled up this video, you should be one of my patients who just got home from the hospital after having had your gastric bypass or your sleeve. And this video is going to have advice for you about optimizing your recovery during this upcoming week, and it's going to give you a preview about your food progression that won't take place until you come back for your 1-week follow-up. Now, if you're not one of my patients, you're welcome to watch this video. Of course, it's public, it's YouTube, but I want you to take it with a grain of salt because I'm going to present some ideas that are controversial, I would like to say advanced, but they don't fit with the advice that every team gives to patients. And if you run across some advice that doesn't fit with your team, you're welcome to discuss it with them, but please don't implement this different advice just on my say-so, because every program fits together like a puzzle, and you can't take pieces from one puzzle and try to plug them into your puzzle. You can't take pieces from my program and try to plug it into your program in a successful way, at least not without discussion. So take these ideas with a grain of salt. Of course, now if you're my patient, I'm going to be presenting some ideas that are different from the commonly accepted wisdom and different from published guidelines and different than what you may have gathered off the internet so far. These are things that I have not talked to you about before because you weren't ready to hear them, and now I think they're going to make more sense. First, I'm going to spend 1 minute reinforcing the two key aspects of your recovery during this week when you've just gotten home from the hospital. And those two key aspects of your recovery, as you know, are mobility and activity and hydration. Then I'm going to spend most of the video talking about the food progression. Now, it's not time to start eating at this point, just when you've gotten home from the hospital, but yet most people are curious about the food progression. They want to know kind of where am I going to go, so it's useful to talk about that. And I think it's also nice to talk a little bit ahead of time because I am going to give you some advice and some ideas that are different than the accepted wisdom, different than what you've probably gotten off the internet, different than what you may have heard from other patients, and actually slightly different from what you're going to hear about in our class, because our class is obligated to present some protocol guidelines that have been published nationally that to me are a little bit old-fashioned. Now back to the idea of physical activity. Having just gotten home from the hospital, having these fresh incisions on your belly, you're probably kind of tired and sore, and you're probably not feeling like moving a whole lot. And there is this old-fashioned idea about kind of laying back in bed and resting in order to recover the best, but that is not what I want for you. I want an active recovery for you. And we recognize that people come into surgery with different levels of physical ability. Some people are relatively fit in spite of the weight, and those folks should be up and moving and walking and actually even maybe a little bit of gym activity. Other people come into the surgery with terrible knee pain or terrible back pain, or maybe they're already using a walker, and I'm not going to expect them to do as much as the other people. My point for you with mobility is I want you to do as much as you can, as often as you can, including getting out of the house. What about driving? I think it's actually fine to drive as soon as you can be an alert and a safe driver. So it's very important not to drive if you're taking medicines that make you kind of drowsy or inattentive. But if you aren't taking a lot of pain medicines that are sedating in nature, which I hope you're not, then it's fine to be out and drive, walk in stores. You can do some light work around the house. And the other kind of common old-fashioned advice with activity is to not lift anything. And you probably don't feel like lifting anything because of the soreness, and I'm not going to make you lift anything. But at the same time, I can reassure you that these little incisions are strong already. Just 2 days or 3 days after your surgery, there already is a good level of strength there so that you really can't break anything. So if you feel like you're able to lift up this or that thing around the house, then feel free, go ahead. Some of you have young children. Maybe the children weigh 10 pounds or 20 pounds or 30 pounds. And with the kids, you don't want to lay down and let the kids bounce on your belly, the mommy trampoline thing, but it's actually fine to do normal activities around the house with the kids. So short version on physical activity, actually more is better. As much as you can stand is good for your recovery. A lot of the pain that you're going to have will come from stiffness, from lack of movement, and so the solution is more movement and more mobility for the best recovery. And of course, the other big key for your successful recovery during this first week home from the hospital is hydration. We want you to hydrate with sugar-free clear liquids. We want you to take tiny little sips on a very frequent basis, just about every minute or so, and work towards a total of 64 ounces of water in the day. Most people don't make that goal in the first couple of days at home, but you should have a steadily improving trajectory of your fluid intake. And also, I want you to watch the color of your urine. We'd like you to be able to pee with a light color, not that darker yellow color. And if your urine is darker or if it's in small amounts, that means your kidneys are not happy with the amount of fluid and you need to drink some more somehow. Tiny little sips very frequently. We'd like people to imagine their new bariatric operation like a tiny funnel. And a tiny funnel means that things should flow through, especially if they're thin, clear liquids like we're supposed to do. But being a tiny funnel, you can overflow it, and that's why you don't take big sips or big gulps. Tiny little sips very frequently. Sugar-free clear liquids is water, broth, and salty fluids are actually very good. And sugar-free clear fluids include Propel and Gatorade G2 and Diet Popsicles, although those have artificial sweeteners. And I also already want to preview for you that we're going to be kind of wanting to minimize your artificial sweeteners in the long run, or perhaps eliminate them as time goes by. During this first week, you don't have a lot of different choices, so the artificial sweeteners are acceptable, but already be aware that there's a concern on those. What we're not doing during this first week is we're not doing food, absolutely, because that's hard on your fresh little stomach. We're not doing vitamins. We care a lot about vitamins in the long run, but they can be a little bit hard on your stomach right now. And we're not doing protein drinks, except in very unusual circumstances that I'll come back to in a minute. So tiny little sips, very frequently. Just be gentle for your stomach, and the more gentle you are, the faster it's going to heal, and the quicker things will be easier on your hydration. As I've been emphasizing, food is not part of the plan for you during this first week at home, and usually that's really easy because usually people have a profound absence of hunger. The surgical changes, the inflammation, the hormone changes that we're already implementing from your sleeve or your gastric bypass typically lead to a really neat absence of hunger. But there are a few people who feel like they're really hungry during this time, and one of my big themes is that I'm going to want you to follow your natural hunger. So if you are the exception, and if you are very hungry some point during this week of hydration, it's acceptable, it's not desirable, but it's acceptable for you to have just 2 ounces of your protein drink, 2 ounces maybe up to twice a day, to just knock the edge off of that hunger. And I promise it will pass. I promise it'll come down to a much lower level. One other option we have obtained recently in our office is a protein drink called Clear Protein, and that also can go a long way towards satisfying your hunger while still being very gentle on your stomach. Again, I only want like 2 ounces for you at a time. I don't want you to have the whole bottle. And as you're going to hear me talk about in this main substance of this video, I'm not feeling anxious about getting enough protein. We're just using protein at this stage to take care of your hunger if you are that exceptional patient with some hunger at this stage. Many of you watching this video have carried the diagnosis of diabetes, and it can make you nervous to not eat anything because you've been taught that in the absence of food you might run into a low blood sugar. And the good news I want to teach you is that people don't have a low blood sugar from just lack of eating, because lack of eating is part of the plan for this week, but they have a low blood sugar from lack of eating plus using diabetes medicines which push your blood sugar down. And you will have gotten my advice, and if you're not my patient, you will have gotten advice from your surgeon about reduced diabetes medicines, and it's very safe to go without eating. Just monitor your blood sugar continuously throughout this process. And if you do find a low blood sugar, which is very unusual, first of all, I recommend that you call your bariatric team and try to get an answer from them in the next 10 or 15 minutes about what needs to happen. If there's any difficulty with getting in touch with your team, a low blood sugar is also a place where maybe 2 ounces of a protein drink can be useful, because that will boost your sugar back up. I want to advise you, in the case of a low blood sugar, don't use sugar pills, don't use orange juice or other juices, because these sugar intake plans are just going to make your blood sugar spike up temporarily and then crash down again, and you'll be in a vicious cycle. But again, just to close out that little topic, the chance of low blood sugar from not eating after bariatric surgery is very, very low. It's a very minimal risk. Alright, so now we're going to move into the main topic of this video, which is a preview about how you're going to gradually move back into regular food. And just to emphasize, we are not talking about eating regular food during this first week at home. This is a preview for when you are back at your 1 week follow-up and you get cleared. The preview, I think, is worthwhile, like I said, because most people are curious, which is cool and awesome, and also because I'm going to present some ideas that are different than the accepted wisdom, and I want to kind of get a chance to repeat this for you and give you a chance to integrate this before it's actually time to start eating. So I'm going to break down my guidelines into 3 big ideas that I'm going to expand on a little bit later in the video. So idea number 1 is that I want you to notice your physical hunger, whether you're hungry or not, and if you're hungry, then eat something, and if you're not hungry, then don't. That's number 1. Number 2, when you feel hungry, I want you to choose some healthy food, which I'll describe in a couple of minutes in the video. And then number 3, it's going to be very important to progress into food in a very gentle manner. Gentle means starting off with tiny little amounts of food. For example, scrambled eggs, you would not have 1 egg, you would have 1/3 of an egg. If you choose beans, you would have not a serving of beans, but 6 little beans or something like that. Okay, so hunger is your best guide, healthy food, gentle progression, and notice here's the big thing, the radical idea. I did not mention eating according to a protein target. You're going to run into published guidelines for women that women should have 60 grams per day of protein and men should have 80 grams per day of protein. That's going to be the main accepted wisdom that I want to set aside. I'm going to explain that, but I just want to plant the seed right now that that's not going to be something that I advise for you as a key guideline. Now, I definitely believe that protein is an appropriate focus for your healthy food progression, but I use that word focus on purpose. I want my patients to be protein focused, yes, but not protein obsessed. And my experience is that these old published guidelines lead to protein obsession, or the idea that extra protein is somehow more healthy. I'm going to debunk that a little bit more thoroughly as we go along, but I'm going to tell you my story about how I moved away from the guidelines. I started doing bariatric surgery back in the mid-90s, and at that time these guidelines were already in place, and I'll tell you how they came about in a minute. But at that time the guideline was that folks should eat Carnation instant breakfast drinks, which was an earlier form of protein shake, twice a day or 3 times a day, or whatever they needed to get that 60 grams of protein, 80 grams of protein every day. And the first thing that I noticed when I was doing bariatric surgery is that quite often those protein shakes made patients kind of miserable, or just the amount of protein that they had to take in made patients kind of miserable. And so in a few selected cases, I gave patients a break. They would come to me, they were distressed, they were crying. I feel sick, I feel nauseated from stuffing all this stuff in there. And imagine, I mean, 60 grams is a lot of food for your new little stomach pouch. And I just described it as being like a tiny funnel. How are you going to get 60 grams of protein in there, even if it's in a liquid form? It's a lot. So I had pity on a few patients and told them, okay, just relax. We don't have to force all the way to 60 grams. Do the best you can. Some of these patients just shifted back to straight, clear fluids, and they did well, and they felt better, and none of them had nutritional problems. And that was my first thought-provoking thing. The second thing that happened over the next couple of years is that I had a number of patients, unfortunately, who experienced weight regain at 2 years, 3 years, 5 years after their surgery. And I saw actually a correlation of patients with weight regain were often the ones, most often the ones, who were really going after the extra protein. And when we traced down where was their extra calories coming from and where was the weight gain coming from, it was often coming from the idea that they needed to get enough protein, sort of at least 60 grams per day. And so I said, well, that could be a problem. And I started thinking seriously about, is this guideline, is this numerical guideline useful? 60 grams for women, 80 grams per men. And I looked back at, where did this guideline come from in the 80s when it was first put together? And it came from a sensible place, actually. This was looking at surgical literature, and it was looking at patients who were under tremendous stress with their surgical condition. But the researchers and the scientists that put together our guidelines were looking at non-bariatric patients. They were looking at patients with cancer diagnoses and burn diagnoses and trauma diagnoses, and looking at the conditions where the body was under sustained stress for weeks or months, or perhaps these patients came into surgery with a certain degree of malnutrition. And they found that these patients actually were doing better if they received regular ongoing protein input. And that was usually to the tune of 30 to 50 grams per day. And I think what the scientists did, as Americans tend to do, is they said, well, if this amount is pretty good, then we want to make it better because more is better. And so they came around to really almost arbitrarily to this goal of, for women, 60 grams per day, and for men, 80 grams per day. But this was not based on any scientific study in the bariatric population. And so in the early 2000s, when I was looking at my patients, number one, who were stressed about having to eat all this protein because of the guidelines, and number two, who were having this long-term weight regain, seemingly because they were forcing extra food in on a daily basis with the best of intentions, I started questioning, well, does this research and do these guidelines really apply to the bariatric population? Because in the bariatric population, yes, there's a surgical stress, but it's a limited time surgical stress. The good news, laparoscopically, is that people recover pretty quickly from this operation, and the body is not under a massive surgical stress, and it doesn't need extra healing resources over an extended period of time, unlike cancer patients and obstruction patients and burn patients. And the other difference about bariatric patients is that our patients are coming into their surgery on a planned basis with fully normal nutrition, and of course, in a sense, with extra nutrition. Not just good protein stores, but lots of extra calories, that's the fat stores, that we want to get rid of. And so, at least philosophically or intellectually, maybe it makes sense for patients to go intentionally on an undercaloric basis over time, or with an intentional calorie, nutritional, protein deficit for a little while, to intentionally draw on the excess stores that are already in the body. So in 2005, I made a very conscious, intentional change in the advice I was giving to patients and started teaching them very much along the lines of the information I'm giving you in this video today. And that is to say, just what I mentioned before, is that I want patients to eat if they feel hungry, and to choose healthy food, and to advance gently. Eat only if they feel hungry. And here's an interesting idea. You know, we're going to say that it's valid if you feel hungry because the bariatric operation has changed your energy set point. It has changed your appetite to a lower and a healthier level, different than the crazy, unbalanced, inaccurate appetite that you had before. And so I'm going to tell you, yes, if you feel hungry, eat some healthy food. We trust that hunger level. Follow that hunger level if it's a physical hunger. But on the other hand, if you're not hungry, then trust that too and don't eat. Okay, and so I started giving this advice to patients back in 2005, and I got a lot of pushback from my colleagues, a lot of concern from dietitians and my surgical partners and national organizations about, well, Dr. Pilcher, John, you know, your patients, they're going to have problems with malnutrition. They're going to have problems with lack of muscle mass, or they're going to have problems with their vital organs like their heart if there's not enough muscle mass for their heart. And, you know, I recognized that I was swimming upstream or kind of going against the accepted wisdom. And so I followed my patients very closely, especially when I started giving them this new advice, and setting aside some rare surgical complications, because it occasionally happens that patients can't eat in a comfortable way. But looking at the group of patients who were eating in a way that felt comfortable, not a single patient had a nutritional problem. And I say that looking at blood testing, I say that looking at the pace of weight loss, and I say that also looking at kind of a fancier test called body composition, which looks at the fat mass and the muscle mass and the bone mass for patients. And as we compared patients with the different tracks or the different guidance plans, there was not any nutritional problem in the first year. And the patients that received the advice that we're talking about now had better long-term sustained weight loss and a lot less stress during the food recovery plan because they weren't stuffing and trying to get the calories in. So once again, we're going to trust your new revised hunger level when it's time to start eating. If you feel hungry, yes, choose some healthy food, and yes, have a little bit to eat. But if you don't feel hungry, then don't. Okay, now I'm going to give you a break on one little thing. In the first couple of weeks when you're allowed to start eating, there's going to be a curiosity, and you're going to be just tired of the sugar-free clear liquids, and you're going to want to, and there's going to be a family social thing. You're going to want to try some things. Yes, by all means, sit down and try a little bit of egg, or try a little bit of cheese, or try a little bit of beans for the curiosity standpoint. I'm not stopping you from doing that, although in the long run, I want you just to feel hungry when you choose to eat. But what I don't want for you is I don't want me or any dietitian or any internet chat group or any other doctor telling that you have to eat on a certain schedule or to a certain protein target. Now, there's a pretty good chance that this de-emphasis of numerical protein goals sounds weird to you. It may sound like 180 degrees of all that you've learned over the years up until this point. So I want to unpack a little bit more where those earlier guidelines or where your preconceptions may have come from. Some of it's medical, like I mentioned. Researchers and surgeons have identified certain surgical target populations who do need ongoing protein intake. I've discussed how that may not apply to bariatrics. But what I think is the other important thing that's happened is that there has developed a medical marketing complex. You've heard of the military-industrial complex, kind of like a medical marketing complex that has been selling lots of protein to you. And if you watched the commercials on TV, you're going to see commercials for this or that protein drink that somehow give you the idea that more protein, extra protein, adds to health, is extra health. And I got to tell you that yes, your body needs a certain amount of protein on a schedule that your body will decide and will let you know. Beyond that amount, extra protein is actually just extra calories. It is not extra health. If your body feels that you're taking in extra protein, it's just going to burn that protein as a fuel source, and that protein that it burned is fat that you didn't burn. And so taking in extra protein above what your body needs is actually going to interfere with your weight loss in the short term and interfere in the long run. Going back and expanding on my three main guidelines, let's first say a bit more about this idea of eating if you feel hungry and not eating if you don't feel hungry. At the 1 week point when you're allowed to move into some regular food, the odds are that you're going to feel very little hunger or maybe no hunger at all, and if anything, just kind of some curiosity about your food. And it can be tricky because there is a mental component here, and you're going to watch TV commercials, you're going to be around people who are eating, and you may be a little bit confused about whether you're hungry or you're not, and that's fine, that's perfectly normal. If you're confused about whether you're hungry, and if you're beyond that 1 week stage, then what I would advise to you is that questionable hunger is drink some water. You know, hydration is always a good thing to do. And if that questionable sense of hunger goes away, then I think you're done and you don't need to eat anything at that point. And then you've hydrated better. But if you drink some water and you're all caught up on your hydration and you still feel this sense of emptiness or this sense of a desire for some food, then yeah, eat a little bit of food. Eat some healthy food. We're going to talk about those choices in a moment. Different people heal at different pace, but the common thing during the first 2 weeks of the food progression is that you might be hungry once, you might be hungry twice in a day. Again, go with your physical sensation of hunger, and if you feel hungry, then you should eat, and if you don't feel hungry, then you don't need to eat anything at that time. Trust your body. Now, some of you are here listening to me and you're saying, okay, Dr. P, that kind of makes sense. I'm relieved that I don't have to force food. I'm going to give you a scenario and make sure that we're on the same page understanding this. Let's say that this Sunday comes up and it just so happens that you're not hungry all day long. You don't feel hungry, you're hydrating, you're out moving around. The idea of food's not intruding into your brain. How many grams of protein do you have on Sunday? Not hungry all day. Okay. Is it 20 grams? Is it 40 grams? Is it 60 grams? Did you get the right answer? Well, the right answer, if you're not hungry all day long, is none. None at all. It really is okay to go for a day or two without any protein intake. Again, your body comes into surgery with massive stores of all different kinds of nutrients, and it's going to let you know when it needs extra nutrients. So 0 grams in a day is fine if that's what your body is feeling, and your body will let you know when you need protein. Now, about 1/4 of you watching this video are still thinking, well, okay, at least I have my protein drink. Again, I'm telling you that you don't need any protein on that day, and I don't want you to have protein drinks if you're not feeling hungry. I'm going to say a little bit more about protein drinks, gently opposed to protein drinks, in a couple of minutes. But only eat if you feel hungry, and only eat enough to take care of your hunger. And in that theme of gentle eating and a gentle progression, you're going to find that amazingly small amounts of food will knock out your hunger. That's all you need. Let's go back and expand a little bit on my 3 key guidelines. Number 1, eat just if you feel hungry and just enough to take care of the hunger. Number 2, make healthy food choices. And number 3, it's a gentle progression into this normal food eating plan. What if you're hungry? So it can be tricky actually in the early phases of recovery to know if you're hungry or not. It's complicated. There's the physical hunger that I want you to notice and pay attention to that's usually really small at this stage of the game. And then there's the head hunger, there's the curiosity, there's the boredom, there's the anxiety about it. And these things mix together. So I'm going to give you a break on it. Just do the best you can to notice if you feel physically hungry. And if you feel like you might be hungry and you're not sure, then what I would suggest is try some water. Hydration is always a good idea. And if you drink some water and it makes that feeling go away, then you're good. And now you know you're not hungry and you can go forward with no food and be perfectly healthy. If you drink some water and you're fully hydrated and you still feel like you've got a sense of emptiness or you want some food, then that's a good time to go ahead and try a little bit of protein-focused food. Another way to know in the long run if you feel hungry is whether you are hungry for something. My experience from talking to a lot of patients over time is that patients, when they actually have physical hunger, they're hungry for something. You might be hungry for some shrimp, you might be hungry for some salad, you might be hungry for some cheese, maybe some nuts. And in general, as long as what your body's telling you is in a healthy direction, I'm going to say yes, go with your choice, go with your body's desire at that point. And in particular, if your body just wants salad and you don't feel like putting chicken or shrimp on the salad at that point, that's cool. You do not have to have protein every single time you eat. Again, I want you to be protein focused, but not protein obsessed. And if your desire at that time or your appetite at that time is for something like cheesecake, then I'm going to say no. I want you to substitute in some chicken and eat some protein that will give you more satisfaction that lasts over time. So then when you feel hungry and you're choosing to eat, I want you to make a healthy food choice. And what I mean by a healthy food choice is something that's natural and that it's low carb and that it's clean. And clean in my book means low chemicals. Chemicals mean preservatives and also artificial sweeteners. It's tricky because lots of people become attached to artificial sweeteners as a natural part of their previous diet plan. We are seeing the artificial sweeteners cause problems with the metabolism over time. All of them seem to do this. And so I'm going to ask you to try to set aside all of your sweet flavors. And to me, healthy foods are, yes, proteins, not with a number goal, but just as a foundation of the food plan. Spices are fine. Cool flavors like salads are fine, and healthy fats can be okay too. As we learn more, we're becoming more keto friendly without being keto crazy. And just like I don't want you to be protein obsessed, I don't want you to be fat obsessed, but all these things in balance can give you a good satisfying diet over time. And what I left out when I was talking about healthy food choices on purpose was protein drinks. And we do use protein drinks at multiple different stages in the process, and protein drinks can be useful not only for liver shrinkage before surgery, they can be useful if you're super hungry in that first week, they can be useful for blood sugar rescue situations. But the problem with using protein drinks as a foundation of your food plan is that protein drinks are artificial food. They're liquid calories, so they don't stick with you very well and give you lasting satisfaction. And being kind of in the family of industrial foods, they do have preservatives and they do have artificial sweeteners. And these components, again, are going to be disruptive for your metabolism. So protein drinks for me should not be a big, common, regular part of your overall food plan. Guideline number 3, the gentle eating. I think that just makes sense. And what I want people to understand is that different people progress at different times. And this is one of the reasons that we as a practice, and especially me, we are not giving you a schedule or a calendar or, you know, on Monday the 13th you eat this. We're not going to do that because we don't know, nobody knows what your body is going to be ready for at that time. You don't know and we don't know. So I want you to notice your body and your physical sensations at that time. What do you have a taste for? Are you actually hungry? And when you're hungry and you're making these healthy food choices, at least in the first 3 or 4 weeks, I want you to start with tiny experimental little amounts of food, not even a small meal, but just an experiment. And you want to use that little baby spoon and the baby plate and give yourself 20 minutes to try 6 or 8 beans, and I think you're going to find that you feel satisfied in a good way. And that's a good learning process. And nobody has to get sick with their bariatric operation if they are cautious and if they go slow. So that's also a big guideline. Now, having said that, as you feel comfortable and as you gain confidence with solid foods over a 3, 4, 8-week time period, it's fine to move forward into more solid foods, typically from mushy proteins like eggs and beans and cheese, then to seafood, then to poultry like chicken and turkey, and beef and pork are usually the heaviest foods that you want to go last. In our classes, we don't teach about salads very much and the vegetable foods. A couple things to say about that. Most patients do okay with salads at about the stage where they're handling seafood and chicken with confidence. So, like I said, if you're doing all right with shrimp, if you're doing all right with little bites of chicken, then you probably can be okay with salad as well. Fresh vegetables can look intimidating, actually, because they're kind of bulky and crunchy, but it's interesting. There's a lot of water content to the salad type of foods, which is great. And the fresh vegetables, we tend to just naturally chew those until it's a nice cool slurry, and that goes down, and that usually works very well in the stomach pouch. Many people have an instinct or an intuition that they need to cook their vegetables before they eat them, and I don't mind if you do that, but quite often people find that cooked vegetables are actually a little bit more stringy or a little bit more difficult. Okay, so that's the gentle food progression mainly means that you try tiny little bits at first, and if anything, you end up, after you eat, being still hungry. Okay, there's no tragedy in that. If you're still hungry, well, then go back and eat a little bit more. But what you don't want is to overeat or overfill your fresh little stomach because number one, you'll feel bad at that time, but number two, it will make your little stomach be kind of pissed off or irritated probably for a day, and that will actually slow down your healing process and your overall recovery and your food progression. So in final summary, my experience with thousands of patients has taught me that patients recover at a different pace, that we can trust your new, reduced, smaller appetite to let you know if you need nutrition at that time, and that if you practice, because it's an adventure, if you practice and learn to follow your physical sensations, that you will have excellent health and the best sustained weight loss over time. Thanks for tuning in, and I'll see you soon at your follow-up appointment.